Oh.
So I said, well, there's gonna be a point when you'll need an alternator.
Okay, I'll reach out to my
Maybe a starter at some point.
Hey, are you chief right now?
No.
Oh. So you can say that.
No.
So you said you was one of the. That's not as I'm told you, I think it was. Yeah. Sweet. They know y'all are that close. So, Christy.
Hey,
How are you?
good. How are you? Hey, good. I know. We thought we'd shake things up today. I know, it's a whole different perspective over here, actually.
We have a
Like
moment.
that.
Exactly.
See, I have a dad who's military, and just like every restaurant here we went, so it just kind of stuck.
All right.
How are you?
I'm well.
Yes. That's educational.
Me too.
Sometimes I wonder. What up today?
Not yet.
How are you? I'm doing well, and yourself? You too. All right, it is 1 o'clock. Call this meeting to order. This is
One
the.
moment, please. Mr. Chairman, I will have to sneak out at 2:30 if we're not done. Oh, sure, we had a meeting in the
Sorry.
I will be asking for a recess.
No,
I was thinking when I
that would
read
be
her
awesome,
email, I
because then
was
I will
like,
have to speed.
is that 1:30?
Yeah.
I think you need about
We
an
go past
hour.
1:45. I'd like to
You got
recess.
here an hour before that. Yeah, exactly.
Yes,
Motion
we
to
need to do
recess
that.
indefinitely.
Okay.
All right, call this meeting to order. This is a special BET meeting for Thursday, September 23rd. Notice the meeting was properly posted Tuesday, September 21st, 2021. Kelly, do we need roll call? You got everybody? Okay. Item number 1, discussion possible action regarding the transfer in the amount not to exceed $358,950 from general fund reserve to general fund court clerk, with $300,000 to go to salaries and $58,950 to go to benefits. Purpose of this transfer is to address pay parity. Mr. Sullivan, the representative for the court clerk's office, has the floor.
Thank you, Mr. Chairman.
You're welcome.
I saw, when the PowerPoint went up, I saw some PTSD eyes who remember the last time that I presented on this topic to this committee. Amy today did not limit my number of words. However, she limited my number of minutes, so I promised to be very quick. I want to start by, Mr. Warren wanted to make sure to thank you guys for taking out of your busy schedules to come to a meeting to hear a presentation about court clerk pay equity for the 4th time, probably. So we appreciate that. I want to apologize to you. 5th time, single.
Oh.
I want to apologize to you because had I given Amy the information she needed, that you all needed, we wouldn't even be here at all. This is not Amy's fault. This is my fault for not providing what you guys needed, and so I'll take responsibility for that. As Cody already mentioned, the request is for $350,000 and change. I'm providing you with a copy of this slide in your handout because it shows where we've been, the money that the budget board has given to the court clerk's office and how we've utilized those funds. Every single year, we've been able to give more in merit raises than what the budget board provided us funding for. Many of you are familiar with the term churn, so when people leave, we don't replace them immediately, and so we were able to leverage those dollars and actually give more money. And then in addition to that, every single year, we were able to turn back a small amount, but some money to the budget board in order for Christy's boss to have some seed corn for the following year. I'm not going to belabor that slide. You've got a copy of it in front of you. Second question, where are we now? So I had Augie send me the payroll from the last couple of months. You can see from this slide, we're still about $1,000 a month behind the next closest office. And the third question that I wanted to address, because these are the 3 questions I heard the most last week. What are you going to do if you get the $350,000 and change? We're going to take the starting pay to $17,000 a year. We're going to
$17.
$17,000 a year.
$17 an hour. And thank you. I get them. guys are a little intimidating. That's why I send it. Gonna take the starting salary to $17 an hour. We believe that that will allow us to continue to attract the best and brightest and to hopefully reduce turnover. So with that, I open the floor to questions.
On your first slide, did it include any time we would do a 3% or 2%, any COLAs, anything across the board? So that was just the money that we had kind of worked in over several years and then your churn, right?
What I did was I don't know why they give me access to the drive that has all the information on it. I went and looked at our actual payroll change orders. So those would be merit raises. They would include one-time stipends. When somebody has maxed out in their pay level, we'll do a one-time stipend instead, so we don't annualize that increase. So those are actual numbers.
So those cost of living and they're not
included.
Your first slide, okay.
Right.
When the original four-year plan was put in place, why do you suspect that it still is $1,000 less per month? Is it because other offices, or not other offices, but these other three offices have possibly given raises as well? Or do you think it's okay?
Yeah, I think everybody's salaries have increased, including ours. I think everybody, continues to be able to do a good job managing the funds that we have.
I guess what I mean is that, so in the 4 years, when it was originally presented, and I wasn't on this board at the time, but when it was originally presented, was it the plan of yours or at the time that FY21 that we would see this slide then and they all be even? Was that the original intent when you made the 4-year parity plan back in FY18?
I appreciate that question because it gives an opportunity to clarify. You really have to compare apples to apples, and that was a lot of people's point last week. When you look at our frontline employees, the clerks, with out of our 128 full-time employees today, because we've lost a couple in the last couple of weeks, 93 of those are that frontline level. Mm-hmm. And then when you also compare that with the sheet that we had put together last week, kind of comparing budget per employee, you see the sheriff's budgeted money per employee has gone up 59%. Well, nobody believes the sheriff gave 59% in raises, right? So what happened? The jail, the lowest paid employees got moved to the trust. If we took, as some of my very good friends have suggested, if we took all of our clerks and shifted them to the payroll of the Supreme Court, our average salary would be a whole lot higher because you're taking the bottom tier out. And so I think when we compare this number, it's good information, but it's not necessarily the gospel of the whole explanation, the entire picture.
So the 358,000, it would be only for those I don't want to use the word lower 93, but the 93 that you're talking about, right?
Again, thanks for the question because I can clarify. The whole pay band structure will have to change, and so the highest percentage of that will have to go to those frontline employees because that's where most of the employees are. Okay.
But you do see it trickling up, which is what Amy kind of explained to us,
Yes.
that it wouldn't just be the frontline starting salary, other salaries would be adjusted.
Right.
Do alignment, yes.
And none of it will happen day one. Typically, our employees come up for review once a year, and so this will happen over the course of time. But we'll take a look at the very lowest at the beginning and make sure that they're not way lower than the newest people that we're hiring in.
I have a question. Providing that you are looking at these average pay comparisons, is it your intention to raise your average pay to be equal to or comparable with the others that you're comparing them with here? I mean, is that why you laid it out like this? Because you want to show that you're wanting to raise, like, take this one for example, court clerk 3942. Are you showing this because it is your intention that you want to raise that to the next lowest, which would be like 49?
I think that's a piece of the picture. I don't think it's the whole picture. And a lot of folks have suggested, do we need to go back before I started here, a couple of years, the county went through the MGT study. And took a look at every position in every office.
Right.
The one thing that the NGT study failed to recognize is that we have 8 CEOs that are all
Exactly.
elected by their voters, and they're going to make the decisions on how they're going to pay their people. And so, do I think that we can ever have absolute pay parity across the county by just taking the average? No. But I think it's a eye-opening piece of the puzzle.
Well, it makes me go back to, how you said comparing apples to apples. I mean, yeah, granted, your average pay is $39.42, like say for July, but you have 130 employees, 93 of which are frontline workers.
Right.
So because of that, just in and of itself, your average is going to be lower.
Right. And what we're really looking at is what does it take to be competitive in the marketplace, both in the building, but also outside the building. It can and probably has happened that when we make a mistake, people can go to jail. I mean, people can have serious consequences if somebody comes into our office and they pay off all of their cost warrants. And when we process that, we don't get every line on the screen.
Sure,
And
absolutely.
we don't recall that warrant,
Right,
they can go to jail.
right,
And so-
right. I certainly don't discount that.
Right. It's mostly about what does it take to be competitive. In painting that picture, this is a piece of it.
So would you, and I don't know because I haven't looked through your packet, is there a slide type like this with frontline workers that you're comparing with these 3 other offices? When Amy first brought us a comparison, she picked one office and it was the highest. And when she was giving us a per hour comparison. And I guess what I was like wanting to see is your basic frontline person that comes in off the street, say you don't have to have qualification on the job training, like you would train them. An average of like you with an average of the other offices.
We have not compared us with an
Because when you
average
do,
of
I agree with Brandy. When you show us 130 and say we're 1,000 off, you got 93 that really brought that down.
Right.
Sure.
So what would be good to see is your frontline workers, the person you bring in day one, and then Amy talked about several phases that you adjust their salary at 3 months, 6 months. I don't know if it was a year and 18 months. There were several steps, and when I took like what she was saying and comparing it to us, we do an adjustment after 60 days, but then that's it.
Okay.
And so when you took our frontline with our $100 more a month at 60 and you take all your steps that she laid out, it wasn't anywhere near that, what you're showing on the screen.
What happens though is as they grow in the office, when we have turnover, it's not all, most of it is going to be with those 90, right? But it's not all with those 90. And so as you progress through there, you're finding yourself in different positions. There's, we require a higher level of clerk. Among that 93 are the 35 clerks that work over in the courthouse, for example. Well, there's a higher level of skill that they have to have learned and mastered by that point to go over to the courthouse, and it takes, then you've got personalities involved with offices and trying to get the right fit, and so there is progression, but they're not progressing in the same job. They're progressing as they progress up in skill.
Okay, maybe I misunderstood her then when she was talking about these. When do you reevaluate and give them a raise if they've done well? I just assumed it was kind of in that same job.
Every year and almost every month, we have employees who are up for consideration based upon that timetable you guys talked about, who for one reason or another, they don't get an adjustment. They may get a 90-day notice that says, hey, if you'll improve these things and do these things, then we'll take a look at you then. They may be at the top of their range and they may not get a stipend. So there's so many facets to it. And then I would love to be able to compare kind of that front line as you go through. But I don't know, I remember when we used to get the salary sheets every month, or they used to be online and you would look at them. Those job descriptions are not always 100% up to date and accurate. And so you may see somebody that is on there, it shows their secretary making 80 grand a year. Well, clearly they've probably moved. We just didn't let payroll, not pointing at Kelly, she's working payroll, but she works for the clerk's office. We just didn't update that for payroll to what their new position was. And I get it, because everybody in this room is in the same boat that we are. You're so busy doing the job that your bosses were elected to do, that to stop and make sure that all of this other stuff, that's good information to have, but to make sure that it's up to date, it's hard to stop and keep all of that. So I don't know if that answers your question, but that's
On the previous slide, you show your lapse from the 2021 and then the last 3 years. You lapsed 146,000 last year, and this year you basically got the same amount of budget this year with 3%, 2% added to it. Could you have used some of that 146,000 to get some of these salaries up? Do you anticipate, is that due to turnover, or you anticipate you'll lapse considerable amount again this year? Or?
Thanks for asking about lapse, because that gives a chance to really talk about that. They're big dollars, 150,000. I think there may be a 221,000 on there. When you look at the percentages, one year was 0.4%. The highest year was, I think, 2.2%. And so when you're managing in our salary and wages $6 million, and you're trying to get to the finish line with a little bit of gas left in your tank and not coming back to the budget board and saying, hey, we need to dip into your seed corn for next year because we gave out too much in raises. I think Amy deserves a huge pat on the back that she's been able to keep those things in line. So I appreciate the chance to address that.
I'll say I appreciate you guys not taking lapse dollars that were allocated for your current employees and using that to get raises, because what that does is that next year you may be closer to fully, employed through the entire year, but you've put additional salary dollars, you committed the county to a full year of those raises when they weren't actually in there. So yeah, you could give the money maybe that 1 year, but unless it was a one-time stipend, it puts the county on the hook to annualize that for the next year and the next year and the next year. So I'll say I appreciate you not doing that.
Thank you, Cody. And to build on that a little bit, anybody that's been to the fourth floor, it doesn't look that nice up there. It really doesn't. And it had to be tempting to maybe transfer a little bit of that money instead of lapsing it and spend it on carpet, spend it on paint, spend it on counters. Mr. Warren isn't going to do that. He made a commitment to his fellow electeds that he's going to use this money as he said that he was going to use the money. And if we don't use it, it's going to go back to seed corn.
I don't have my information in front of me, but I remember looking at estimate of needs, and I thought I remember 124 full-time employees on estimate of needs. Does that sound familiar?
I think that I appreciate the chance to address that. I think that that I would acknowledge, and everybody would acknowledge, that our budgets historically have been built on a number that's more around the 126, and we've crept up to the 131 number. And so we're going to try really hard to use some of that to leverage, because the cost of this, if we were to do it all at once, is probably higher than the 350. But one example of that would be Jury Monday morning, something that everybody sees, right? We used to do it with 3 people. Now we do it with between 25 and 30 people. We got to intercept the folks out at the street and get them to go down to the skirvin and get in line. And we do it in the tunnel so they can't see how far they are from the courthouse. But we do that with the employee census that we have. We didn't add to our employees. They're down there about 3 hours. They get here at 6 o'clock in the morning to do the setup. They work until about 9 o'clock because of the commitment that the sheriff's office has made to help get people through really quickly, and get torn down by 9 o'clock. So I think, to clarify, that's a good point. We want to try to get back down to more that range of 126.
I think that maybe COVID subsides at some point, and maybe that would kind of go back to normal. Is that what we're thinking?
Hopefully, if COVID subsides at some point.
That's a big question.
I know we all struggle, right, with getting, having.
I know that
bodies
you had to
in
do
seats.
more workload and a lot of things different, like all of us have, so.
Well, and hopefully in the not too distant future, we'll be able to do some modifications to the first floor of this building that will allow for more folks being in that area, but be social distanced, and that might help alleviate that strain. That's not something we can do immediately, or we'd be looking at using CARES dollars. It's probably gonna be an ARP expense because we can't get it done by the end of this calendar year. But that's something that's been discussed and looking at to help alleviate that pressure.
So in 2017, when the pay parity started, it was based on 118 employees. Today you're at 133. In 2017, we started out at a 3-year pay parity, and now we're at year 5. I have trouble justifying 5 years when we asked for 3, but we've also increased our employees by almost 18 employees. They've gone from, we got 133 in the third. I'll give you the 133 in the third employees. So that's what's on your payroll.
I looked at my payroll purchase order last month, and it was not 133, it was 130 full-time, it was 1 part-time. We have our revolving fund payroll, and there's about 8 employees on that, but that's not supported at all by the county. We spend about $300,000 a year. But I understand what you're saying. We started with a 4-year plan. What we do with that money, we gave it for merit raises. Where did that leave us? It left us pretty close to where we were. I understand your point.
So your goal, you said, was essentially to raise your frontline workers up to $17 an hour.
Right.
If you were,
Mr. Warren's goal.
Sure,
Yes.
your office. So if your office received the transfer that you are asking, would that get you to that mark?
That's, our intent is to.
That's all it would
Right.
take to get you to that mark. So, provided that happens, and you were able to bump everybody up to 17 an hour, would you foresee another ask, like say next year?
Wish I knew. What's going on in the labor market right now is crazy.
Mhm.
We started talking in January about people screaming and yelling about getting minimum wage to $15 an hour, and now to hire people at the jail, we got to spend $20 an hour. I wish that I knew the answer to the question. I think we'll all be in that same boat, though. I think we'll all be in the same place and have that need for competitiveness.
Right.
What I
Right.
appreciate is the partnership that we've had for 4 years.
Mhm.
And I'm asking this year, Mr. Warren's asking for another step. And, you know, I think we'll all have to take a hard look next year at where we are and where we need to be.
That's fair.
I don't want to cut off questions, but I'm glad to make a motion.
So if we've got 17 employees, you've got, looks like about 17 employees under the $17 an hour. By your payroll.
Okay.
So we're just wanting to raise those up.
We'll adjust so we have our pay bands that are on the sheet of paper for what each of the, within any job, within clerk, there's a clerk 1, 2, and 3. There's a minimum, there's a mid, there's a max. Within any of those, that's where somebody's going to be classified. And so as they come up for their next adjustment, are we moving them forward or are we keeping them where they are? If we're keeping them where they are, they're just going to get whatever this adjustment would allow. If they're moving forward into a more responsible position, if they're taking on more duties, if they're taking on more responsibility, that's kind of where they progress through. Does that, I'm not answering your question, I can tell by you looking at the scene.
No, just, you got 17, it goes 17 employees raised to $17. Your next person above $17 is $17.37 an hour.
Okay.
Approximately. By raising all the 17, what you're wanting to do is keep the percentage separation that's in there now between all these employees and the different jobs. You're wanting to keep that separation, that percentage separation, meaning you're going to want to, as we raise the C, we're raising every vote.
Sure.
That's what you want to do.
Sure.
So everybody, you're bumping everybody's pay up.
Bumping the pay scale up, and if they earn a merit adjustment, then they will get it.
So we're raising everybody's pay and we're giving merit and 3% COLA.
Well, the 3%, yes, we did give the 3% COLA. I believe it's Mr. Warren's intention to do the 2% through payroll, that was just given in September. Anything else, other than those that are below $17 an hour now, we've got to take a hard look at those and see where we're at with those. They're all in their first 90-day probationary period, but we don't want to leave anybody behind.
So after that 90-day probationary period, where do they go to? Starting pay wise. Because if we're at 1687, and the next above it is 1737, that's above the 17 we're reaching for.
So currently, after the 3% COLA, starting is 1526, and from there they go to 1607,
Right.
which is from 20, so it's about $190 a month, 2646 to 2785, $140 a month. Is that what you're asking?
So I showed 3 at the 1526. Is that what you got?
I don't have the census in front of me,
Okay.
but I wouldn't disagree with you.
And then 5 at the 1607. And then I'm assuming that step 2, from whatever the promotion from 1526 to 1607, that step 2 is the 1687, of which you've got, it appears to me about 9. They all started within the past year or so, it looks like.
So,
Some of them within the past couple of months.
1687 the past couple of months?
No, I've got 1687 that started in April.
After the 3% was approved in July, we start people at 1526. Their first step consideration is 1607, and then their next one is at 1687.
Yeah, I mean, I've got one here in July.
And-
It's 1687 an hour, so I'm just trying
Sure.
to figure out.
If we hire in somebody that has experience, if we hire in somebody that has some talent, we may not start them at the 1526. We may start them at a higher level. We may have a need, when we hired Steve Wilson, he came to us with a whole bunch of management experience and was willing to go through and learn every job in the building. Well, he didn't start at 1526. I'd have to go back and look to see where he started, but he probably started about $23 an hour, something like that. But he's making quite a bit more than that now. But he manages that whole crew of 30 people on Monday mornings for our jury process. He's been running our Edmond office. Now he's up here, unless he has to be up at our. I mean, he's a Swiss Army knife. So it just kind of depends on the position that you're hiring. Just like when you look at anybody and their new hires, we've got people that have been hired at the county recently, kind of for 1670-ish, moved up fairly quickly. But we have others that have been hired in the 20s because they're, maybe they're driving a bulldozer, which you better get somebody that knows how to run that thing and not somebody like me versus, out, with a rake and a shovel.
Out of the 300,000, have you all done a mock on how many employees you would actually apply that to? Like actual incumbent names that it would actually affect?
I've gone through with the current places where the salaries fall to see what that would cost if it was all done day one. But with all variables, are they going to stay here or not? Are they going to perform well or not? Are they going to progress or not? It's hard to get what that exact figure is. It's a bigger number though than 358,000. Just like we've been able to give more money in raises than what the budget board has given to us. I'm sure that our raises this year will total, with Friends especially, will total more than 358,000.
Where did the 358,950 come from?
You know, the reason I apologized at the beginning of this meeting is that because I was not all that engaged with Amy on this process, on the building of the estimate of needs. And so I think when you take a step back, that even last week, and even as we went through this process, that most people would recognize that the court clerk employees are paid lower than the other employees in the building, and that there probably is a need to do something, but without hard numbers, it's hard to know exactly what. I think when you look at, I wasn't tracking it, you know, to look at how much money were we given in pay parity, how much money did we actually give in raises, and how much money did we lapse. I mean, I wasn't doing that detailed tracking. I believed that we were doing a great job of estimating what we needed in order to get to where we were going. And I think our track record shows that we have done very well with what we've been given on the road to where we're going, and that we've kept our promise to spend the money and even more money on the things that we promised that we would spend the money on. But I just would have to plead ignorance that we weren't tracking it to that level. We believed it was the case. I think the research that we've done has shown that was the case. But to tell you that we calculated this down to every penny, I think it was just more of a feel of what we know that we need based upon where we've been and based upon where we still continue to stand. I think this number's probably pretty close to what it was when we started.
337, 792 is what you asked for the first time. Second time was 326, 352, 364, 136, and 19, and 342, 760 last year. So these numbers are all kind of just wags.
What I meant to say was this number, where we stand in relation to the other four offices. I bet if I can go back and find those documents from 4 years ago, I bet we're all kind of about where we were when we started 4 years ago. So, I mean, there's two ways to do it. We can either continue to try to do our best to catch up, or we can get left farther behind than we are today.
Can you use the your new special fund for any of the positions that you have?
Awesome.
I know you just spent 900,000 on the
I got it.
nice little fee, and I'm sure that, have you been collecting it for a full year yet? And it's already generated well over $1 million?
Over a year we have been collecting it. I'm so excited, Miles. Thank you for asking that question. So this records preservation project is really cool, but when we go to the legislature and we ask them for money for records digitization, we promise that we're not going to take that money and just replace what the county's already spending and then take that money and spend it someplace else. So we went to BIS. They've got this awesome software as opposed to OSCN, where an individual has to take the keyboard strokes and every letter you see on OSCN, unless it's a scanned document, and everything that happens there is a human being touching the keyboard, touching the mouse. This is going to be automated. The data is going in. Year one, we're going to use their employees. Steve is going to head up this project. He's going to go over there. He's going to learn how they design it, how they set it up. By the end of year one, we're going to be hiring in new employees. They're going to be hired on that new records preservation fund, and we're going to take documents that people don't get access to. You know how frustrating it is if your wife has to go and get her real ID, and she has to get a court record, and to be able to do that, and she has to wait a couple of days or longer. Not your wife specifically, maybe she's a very patient person. My wife is maybe not so patient. She's got to wait on that record. How cool would it be that she'd be able to access it on her own? Sorry, I didn't get so excited, but thank you for that.
No, absolutely. So I
yes.
heard two things there that kind of scared me. One is you're adding a whole lot more employees.
Not a whole lot more.
Well, you just said you were going to hire
more employees.
Okay.
Yes.
So
And they will be on that records preservation fund.
For that record preservation fund, is that going to reduce our spend yearly for storage of those feeds, of all those records?
Not year one, but eventually, absolutely. Now, I don't know if you're the court clerk that has to say that I destroyed decades of information that you want to be that guy. But what it will allow us to do, because we have to get in those boxes every day, when they're scanned and we no longer have to get into those boxes every day, and we can tell people, oh wait, the scanned image is not good enough, you need the actual original piece of paper. That's going to take us a week or two to get to, and we can implement then Keith's plan of using less space and having boxes on pallets that we can move around and access only if we have to, not every single day. However,
So that's a no.
I'd love for that building to be purchased by the county. I would have loved for that building to have been purchased by the county day one. By year 10, which we're approaching, we will have spent enough money that it could have been purchased.
That building's used for record preservation?
That building is used to store records, yes. But again, it's money the county was already spending, and if we shift money that the county was already, replace money that the county was already spending with new dollars, then we've broken our promise to the legislature. And I think Mr. Warren pretty good at keeping his promises. Can I make a motion, or are we?
Anybody else have anything? I'll just say, I appreciate Mike came by and we discussed some of the stuff, a lot of the questions that you guys have asked. I hammered him pretty good, and I appreciate you coming and clearing some things up for me, and answering the questions, taking time out of your schedule. I appreciate it, and I appreciate the information that you've been able to provide.
I would move that the BET recommend to the budget board an increase to be used for pay equity in the amount of $358,950.00.
Do you need to make a motion to accept the report first?
I would appreciate that. It was not attached to the agenda.
So moved. Motion to
Thank
receive.
you, Brandy. We have a second. We have a second. Did you get that, Kelly?
Who seconded?
Brandy made the motion. Brandon seconded to receive the
To receive
document.
the document. Got it.
All those in favor say aye.
Aye.
Any opposed? Ayes have it. We have a motion on the table to make a recommendation to budget board to transfer an amount not to exceed $358,950 from general fund reserve to general fund court clerk. Is there a second?
I'll second.
Got a motion and a second. Let's go ahead and go
Do you
around
mind
the
if I
table.
called your name?
Let me just go right around.
No. Will you mind if I go
Yeah,
by
let
my
me
list?
just go right around, please. Mike,
Yes.
Miles,
I think you need something, but I don't think you need the 358. I would love to see some sort of discussion about taking the lapse funds and including that with the 358. I understand your budgeting, I appreciate that, but for that reason, I'm a no.
Danny,
Yes.
Christie,
Yes.
Brandy,
Yes.
Mike, yeah, Brandon.
Yes.
And I am a yes as well. I would like to say though, that I mentioned I appreciate you coming back. I appreciate what you said earlier about not knowing where you're gonna be next year. I do anticipate though that any further discussions related to this is gonna be more of a global in nature, because we're all facing this. And I've seen to where you guys have turned back money that you haven't given. I understand you're appropriating this to pay bands, and if people don't deserve the pay raise to meet it, you have a track record of turning that money back, and I know that will continue to happen. But I am hoping that we can strongly consider looking at salary study and looking at this globally, because I know there's a lot of offices that are in similar situations as it relates to employees starting pay. So, but I am a yes. Thank you. Motion passed. Item 2, discussion possible action regarding resolution, well, I don't need to read that. Transfer of appropriation from CARES Fund capital account to CARES Fund facilities operation account in the amount of $37,800. Purpose of the transfer is for the cost of disinfecting the building for July through September. We had some discussions on this a while back. Facilities has money in their CARES portion of the CARES account, but it's mostly in the capital. So to be able to pay the bills that are going to be due July, August, and September, we need $37,800 to be moved from capital to M&O.
I'll make a motion, we recommend the transfer.
A second.
You got a motion and a second. Kelly, did you get that? Okay, thank you. All those in favor say aye.
Aye.
Aye. Any opposed? Ayes have it. Item 3, discussion possible action regarding funding for the disinfecting team from October 1 through December 30 in the amount of $19,800. This item was discussed at BOCC. Currently, where the $37,800 came from in item number 2 was 3 months of 6 individuals that was disinfecting courthouse annex, ICB, as well as a parking garage. BOCC made the decision at their most recent meeting to go ahead and modify that from 6 to 3. So this $19,800 is reflective of that change, and it would cover the expenses for October, November, and December, which would get us through the final date of expending funds from this CARES account.
On this agenda item, I'm assuming it's the CARES fund, the item just doesn't say where the funding is coming
sorry.
from. Is it CARES?
Well, I think this is kind of a general, I didn't put this on here, Keith did, but I think it was more of a general, let's talk about possible solutions. I don't think we need to necessarily take action today. This is something that we're gonna be covered through the end of September, so we can always discuss this and have a recommendation at the October budget board for a transfer. I do believe on a future agenda item, it shows that currently there is in facilities 69,661.35 in there. If we spend the 37.8, that leaves 31,861.35. So there should be sufficient, if my math is correct, sorry if Siri is correct, there should be plenty of money in their account. If that situation changes, we can always move money from one of the other CARES line items.
A quick comment on that.
Mm-hmm.
We hear from jurors every 2 weeks about how much they appreciate seeing people out there cleaning and wiping down the building. This is a lot of money, I get it. I'm glad we got the CARES money to do it, and we didn't, have to do any county revenue to do it. But it is, if nothing else, other than PR and making 500 people that have to get jerked out of their life and come down here, it sure makes them feel comfortable. And I think probably a lot of people that aren't here for jury duty but come here for other reasons are in that mode as well. So.
Well, and I believe there was discussion about potential discussion occurring with the presiding judge and other stakeholders. That 3 number, I mean, it could change. I mean, that's what it is right now. What BOCC decided, it could go from 3 to 0, or it could go from 3 to 6 to 9 or 10. We don't know yet. I'm anticipating
6 to 0. Just if we change the contract and they don't like the terms of the contract, they could just say it's not worth our time to do 3. So that may be another issue to pay attention to on that contract.
Chris, if memory serves correct, the contract is it's kind of the on-call provision in there. So we're just telling them how many we need, and then we modify that, right?
Yes,
Yeah.
yes,
Yeah.
2 week.
With a 2-week window. But the 2-week window is more to allow them to have time to respond and move their pieces around that are necessary to get them here.
That was just something brought up.
Okay. Which is part of the reason why I think on item 3, I think it's good for discussion right now, but as far as making recommendations, right now, that's what that number looks like it needs to be, but I don't think we need to take action just yet, and that number may change. So I think discussion is good, but I think we're a little premature to make recommendations on the funding
Yeah.
source.
Let me ask one question.
Sure.
Because this starts October 1, does that mean so that they're not gonna have the money covered on October 1 if we wait till the October budget board meeting?
well, they're just now, we're transferring the money for them to pay July.
I know, but that's
So,
not really the
there
way it
should
should've went
be-
down.
They should be taking care of that. I mean, I can't answer that for you. Kelly Thomas has not mentioned anything to me about it, so I don't know. Danny, what are your thoughts?
I mean, if the money needs to be encumbered first, you know, they currently have 69,000 encumbered out of their cost center there. I don't know if that's.
No, they've got,
That's a balance.
No, that's.
no, that, you're right, that is does that 69,000 that's encumbered, do you know how much of that is on this?
That's what I do not know.
There is
Yeah.
0 encumbered.
What's the 69,000 encumbered
I
against?
can go look. Would you like for me to? But I don't know off the top of my head.
Yeah, they would have to have a PO in place
Right.
first, for sure.
I thought they had something though that was already there for their,
They're waiting for this 37A to get appropriated before because there's only $500 or $272 or something like that in M&O. Facilities M&O 352.
so how did we, for July and on? Okay. Oh. Leave that alone. I mean, I guess I'm not too adverse with that information to entertain just moving all of the money that's in facilities current account from capital into M&O to cover that. But that's still, you know, I was looking at the wrong number when I calculated
I
this.
think the 19.8, as I
So you're
understand it, is for 3 people for the remainder of October through December.
Yes.
You're talking about moving the entire 69,661?
Well,
No.
That's it.
no, that's what I was
All you have
looking at
available is that 53.
earlier, but the available amount's 53.
53,931, yeah.
And if nothing's encumbered, then these two
So
and
there's
three is
only,
57.6.
there, if you take the 53,931.57, that's what they have available in that account. If the 37,800 is not currently encumbered, then we have to take that out, which leaves 16,131.57. There's not enough in there to
Well,
cover the
The
19.
37.8 is coming out of 350. It's a transfer from capital. 350, right?
I'm sorry?
The 37.8 from item 2 is coming from 350 to 352, not from 352 to 352, right?
Yeah, it's coming out of the 2.7 in that first column, transfer to 352. Action on item 2.
Okay. Then facilities currently in their account, they've got the 53,931 in there. Is that in their M&O? Is it in their
There's only like
capital?
$200 or $300 in M&O, the rest is in
It's in their
capital.
capital.
Yeah, 'cause remember
So the
we didn't move
19.8,
much.
I mean, we could move, I mean, at this point, we couldn't move the full 50. Well, that's more than the 19.8. We could move the 19.8, recommend funding the 19.8 from the facilities CARES 352 account. Move it from their M&O. Is that gonna take budget board action though, to move it? Yeah, even within the 352. Well, but the other was moving from 350 to 352.
No. To do the contract to pay this for Keith last month, that's the way we did it. We had to move because he didn't have enough in the M&O to be able to pay for it, so we had to move the capital.
Right, but we're
So we've
moving
done.
from 350 capital to 352 M&O.
I think it was like, I think it was all within his 352.
Okay.
One of us is wrong. I'm betting
appreciate that confidence, Miles.
No worries.
Wait a minute,
No.
now I'm wondering if I did this right, because 350 capital?
That's what I,
I think I might, let me see something here.
Most of it was an M1
Yeah.
on 350, unless we needed it later.
Kelly, I thought we had in the 352 account, and I apologize, I saw the CARES Fund 1,400, I did not pay attention to that 350. I thought what we were doing was facilities had $53,000 in their 352 account, but it was all in capital.
Yeah, I think
And we
you
were
might be right.
moving, that our agenda item on 2 was moving it from their capital, 352 capital into
I
352
think you
M
might
and O.
be right.
But that's not, looking back, that is not, this is 1,400-350.
Yeah, you took the 37.8 out of the main account and moved that over.
Which is not what I was thinking that we were doing, but we can. And then that would leave sufficient money in their account, the 53,000 to cover the 19.8.
I don't know if we've got that much in capital, do we?
Let me go take a peek right quick.
Please.
I miss the days of the coffee pot at BET.
Do it.
I miss the days of the coffee pot at BET.
Those are our longer meetings. Cans of brownies, coffee.
This time in the afternoon.
Somebody check that top drawer, I bet there's cookies in there.
Just in case you get the mind to take my
Well, I thought you were checking the top drawer.
So did I.
Don't get on 235. You know how backed up it is. I'm looking down shields. 235. We did right here before it gets 540. It's like when I came in.
Stairway to parity. You should have inserted a soundbite for Stairway to Heaven in here.
Well, so full disclosure, as we talked about this week, that presentation went from 9 slides in 16 minutes to 3 slides in 2 minutes. I mean, you were right to get a little nervous when you saw the PowerPoint pull up. 'Cause, you know me, I can talk. So,
I just want the same parity. Can we get that?
I know she went to grab it, but we've got it pulled up here, what's available.
Okay. $2.1 million budget increase for 4 years.
I think what she's looking at
Just for parity.
is 350.
So,
There's nothing. No,
yeah,
so here's 350, we got 18,000.
well, we just tried to transfer 37 down.
Yeah, this doesn't work.
I don't think we're gonna have any problem with that legislation. No.
So I think the intent, I was looking at the last BET agenda.
You can use it for employees, you can use it for records, you can use it for buildings and preserve records. And those are funds that we expend money for now that we could have just, we should transfer in the future. But we're not doing that. We go for spending work. Those would just be added.
Mm-hmm. See, that's what, yeah, I think we meant 352 to 352.
Yeah.
Yeah, and I don't think we can't do that with this agenda item. but we can,
Right.
So, I mean,
Well, so that's what I'm saying, though, if we use the regular reservation funds,
and
and buy a building,
in the
they're those
main
funds, they're all
capital,
capitalized, they don't.
the 350 capital accounts, there's not,
Whatever it costs,
there's not the 30,
especially if you're talking about time.
37,000.
So that,
All right,
10 years or whatever we're talking about, that 10 years. will
So-
we could buy the building in 2 years, especially after.
item 3, there's not anything we can, no action that we can take on item 3. Is there a motion to,
What are you doing?
trying to get Christie out of here by 2:30? Okay,
my
Kelly-
presentation was only 2 minutes.
It's all business.
Kelly brought this information back that Danny has pulled up there. Let's get a motion to reopen item number 2, please.
So moved.
Second.
We got a motion is second. All in favor, say aye.
Aye.
Aye. Item 2 was supposed to show transfer of appropriations from CARES Fund 1400-352 capital to CARES Fund 1400-352 facilities operation. It was supposed to be a movement within the
352.
facilities, which is what I thought it was.
Yeah.
That's what I thought we were doing on 2. That's not what 2 says. There's not money in the 350 capital account sufficient to cover that 37,800. So let's get a, do we need a motion to reconsider item 2? Because we already took a vote.
Didn't we just make that motion?
No,
We're
we're
reopening
Open the
it.
agenda item.
But we need to undo
So
what we
can I make a
did.
motion to strike the previous
Recommendation.
recommendation and
Sure.
modify it
Second.
accordingly?
Yeah.
To reflect 1400-352 capital.
No. Let's just undo it first. Let's undo what we did and then we'll have
Okay,
discussion.
I make a motion to undo the original.
It's do-over. I call do-over.
We got a motion to rescind the recommendation.
I'm still second on the mulligan.
Okay, we got a motion to rescind our recommendation to budget board to transfer appropriations from CARES account 1400-350 to 352. Miles is seconded. All in favor say aye. Aye. Any opposed? Brandy, to your point, I don't think our agenda item gives us the latitude to
Okay.
do that because it says 350.
Right.
So
It's just a Scrivener's error.
So what? Yeah, they need this money.
Aaron, are you looking at the agenda? Would you say that that is a Scrivener's error or
Doesn't matter that it's a Scrivener's error,
That's
it's still not
the new,
sufficient
yeah,
notice.
yeah. So here's what we're probably gonna need to do, y'all. We're gonna have there was a request for a special budget board meeting to address the court clerk's item. And we had this meeting today squarely to address that. What I think we're gonna need to do so that we can get this bill paid and get the bill paid in October sufficiently is schedule another special BET prior to budget board. If we have to schedule it for a day before budget board, Kelly, you and I can get together and put preemptive language on budget board. And if we wind up not doing it, it can be stricken. But that's the only way that I can see us moving forward
So
to
you
get
see,
these taken
you
care of.
know that special budget board's set for next Wednesday at 11,
Okay,
FYI. in case you didn't see that.
so Tuesday, we're gonna have to,
Or Monday. Well,
or
no.
we could do Monday at say 3:00.
Yeah,
And then that gives us Tuesday to amend the budget board for Wednesday. So when we get out of here, Kelly, can you, Okay.
Let me, okay, never mind.
all right, so is there a motion to strike item number 2?
Oh, have we not already just taken care of that by the rescinding?
Why would you strike it? It's not gonna carry forward.
No, we're not carrying this thing forward.
That's what I'm saying.
Well, that's why I was talking about striking it, so that we get something with new language next time.
I understand now.
Yeah.
All right, let's go ahead and, I'd prefer to get this off the agenda. Is there a motion to
Motion to
strike?
strike.
Second.
Motion and a second to strike item number 2. All in favor say aye.
Aye.
Any opposed? Ayes have it. Now it's clear that that is stricken and no action taken off of it. Item 4, discussion possible action regarding the development of a list of potential COVID-related.
What did we do on 3?
No action.
No action. Just making sure.
Item 4, discussion possible action regarding the development of a list of potential COVID-related expenditures/projects for the county's remaining CARES dollars. I had requested this item to come on here. We've got an amount coming back from OIA, $2,592,671.95. You can see that on the attached document. I wanted to start some discussion. We have until, as of now, we have until the end of December to expend those funds. So we need to start having some conversations. I know Ms. Overstreet talked about hazard/hero pay, and we had discussed looking at that globally. I would very much like us to look at that as an item for expenditure of the remainder. Not necessarily all. I mean, I don't know what that dollar amount's going to be, but I think that's something that I would like for us to look at. I don't know if anybody else has items that they want to look at as well, but I think we need to start seriously considering what we want to do with the remainder portion. Right now, it looks like if all the money that's currently allocated and encumbered in the various accounts through 51, 52, 53, and 54, if all of that stuff is spent, we still have a little over 2.7 million in there. So
The one that's kind of the amount that emergency management has, that one scares me more than us getting 2.7 million.
right, yeah, and
Because
I'll have a conversation with Mr. Barnes. Yeah,
it's not, I mean, are we gonna buy stuff with it, or
we need to find out
give them
from David where we are on PPE, if he's going to need to make some additional expenditures. If not, then if all that money isn't spent that's in 51, 352, 53, and 54, then we have just over $3 million.
That's right.
So
I'm not worried about the facilities, that should.
the 53, yeah. So we do need to start having some discussions.
It's the 2.7 and then the 324 that David said, because that's, I would probably say we probably should look at
Moving that back.
moving that back in, because I don't know that what $324,000 worth of PPE looks like, but that's a lot of mass.
Well, and that number hasn't moved in a long time. So, but I would like to have.
And our largest users of masks, they can't use masks that we have, that we can purchase. I don't know. Doesn't make sense to me.
Any thoughts? Anybody?
The only other, I mean, obviously the cleaning, it's not a big dollar amount at the end of the year, but just getting 12% on what other employees' benefits claims we can reimburse ourselves on.
Oh, I can tell you what the next batch amount is, if you're asking.
Sure.
288,000.
Do you know what that goes through?
No. I just got it. I'm not sure.
No, absolutely. I'm
Yeah,
aware of
yeah.
that nowadays.
I think one thing that we need to remember is there's lots of things, not everything, but there's lots of things that we can use both CARES dollars and ARP dollars on. So if we make plans and, for instance, if the hazard pay and cleaning and there's other projects and, we put you know, say 600,000 aside for employee benefits, anticipating that if that dollar amount winds up coming in higher, we may be able to shift and look at ARP moving forward on the health plan costs instead of CARES. We're gonna have to look at that anyway come January. So I know we've got some infrastructure projects like the one on the first floor that I was mentioning earlier, but we just can't get that completed by the end of December. Out at Juvenile, that new lobby that will really help social distancing out there. I mean, that will be very beneficial for social distancing, but there's just no way to get that project completed. So those in my mind will have to be ARP, because we can't.
What was the timeline on that one?
400 and something.
No, not the dollar amount, timeline.
Oh, well, a month ago, Stacy thought that we could get it done.
Yeah.
But now, we're a month later, and when I asked him the other day, he said he didn't think so.
Before or after budget?
Those are CARES funds. Oh, that probably wouldn't care.
I think it's
CARES
enough.
funds.
Art funds for sure. Sewer.
Amy, feel free to come back.
All right, well,
It's probably just a good item to have there for everybody to get it on their heads and start thinking about it, talk it to their bosses and everybody else to figure out what's going on. So I don't think any decision should be, or could be, or recommendations could or should be made today, but
yeah,
it's a good discussion.
I worded the language specifically to have a discussion and not for a recommendation. I'm not anticipating us making a recommendation yet, but I do want to start getting the ball moving forward. That way we're not sitting here December 1 and have those funds and have things that we really could have utilized the money for, but maybe be a little too late to do the necessary legwork to determine, for instance, on hazard pay, who qualifies, how much we're gonna do. Is it, you know, I mean, that's gonna take a little bit of time, so.
I move that we receive thinking about discussing this item at some point in the future.
No action needed.
Oh,
But thanks.
All right,
Amy, feel free to come back.
item 5, discussion and possible action regarding an update on the implementation of House Bill 2311. Jamie?
Good afternoon.
It was.
I think this is rodeo 5, maybe?
I know, it's like, at what point do you want Cody and I to give this?
Motion to receive documents.
Second.
All those in favor say aye.
Aye.
Aye. Any opposed?
I mean, I'm for
You
it.
should.
I'm for receiving the document.
Some of the
And when is
questions
Amy gonna
that,
be back up here?
See, watch out.
I'm trying to get up to speed.
That's how it starts.
some of the questions that have come out of previous presentations, whether it was to this group, policy, or to budget board, we are trying to just address some of those information requests, so to speak, today. Not asking for a vote on anything, but a lot of questions surrounding our proposal had to do with what does Tulsa have? How many officers do they have? How many mental health do they have? So I wanted to provide that to you today. The first chart is shows officers per unit comparisons for Tulsa, Comanche, and Oklahoma County. When I say unit, what I mean is like pod. We have 7 in our facility, separate pods with cells in it. So that's what I mean when I say unit. So Tulsa has 19.33 officers per pod. And Comanche 1675, and we are currently at 9.14. So what I did is I applied the ratio of 19.33 from Tulsa County and said, well, if we were using their ratio, how many officers would we have? And we would need 135.3. We have 64. With Comanche County's ratios, we would need 117. we're asking for 15 more. So I didn't know if somebody has another scenario that they would like for us to do. We've done the federal model, we've done several different things. We're happy to do it, we welcome the ideas. I wanted to show you an officer to bed or cell comparison. So in Tulsa County, they have 1.09 per cell. In Comanche, it's 1.34, and in Oklahoma County right now, it's 1.22. Again, using their ratios of how many officers per cell that they have, we would need a total of 85 if we followed Tulsa in Ward 64. We'd need a total of 104.5 if we followed Comanche County. So it's just another way to look at how things are structured in other places. Some of the other things that we talked about, how many officers do these people have? How many units do they have? How many shifts do they run? So that's what your second page shows you, is the number of beds or cells and how many units those are located in. So for example, in Comanche County, they have 2 units with a total of 25 beds. And each of those are listed as to what they have. And the next column shows you how many detention officers that they have. They are all on the 3 shifts of 8 hours. The next column shows you how many YOs that they currently have. And it's interesting, Tulsa is really gonna be up against some big challenges because they have 5 YOs right now with 21 sitting in the county jail waiting for November 1st. And they only had a total count of 26 a couple of days ago. But if you add the murderers that are in the county and the YOs that are sitting in the county, 61 of their 63 beds are gonna be full. They have 3 master's level therapists full-time and 1 case manager. They are quite a bit farther behind Oklahoma County in terms of planning, meeting with elected officials, meeting with the different boards to try and scratch our heads and say, what's the best that the county can do? Where should we put resources? They're just now starting. So when I say what resources are they requesting, all they know now is we need more officers, we need more supervisors, and we think we're going to ask for some medical staff. But I don't have any numbers. Craig County is not really, it's in Bonita. It's not really a good comparison to anything, but they were one of the people that responded to me, so I included it. They only have 13 beds, and they have contracts with 44 counties because they're one of, I don't know, there's a whole bunch of counties up there, Kay, Ottawa, they don't have any facility. So they've been taking murderers and YOs forever. So they don't anticipate any change. Their count stays between 10 and 13 kids. Right now they don't have any YOs and they have 1 female charged with murder out of Ottawa County. They have 1 part-time licensed therapist. And then, as you know, we have 78 cells plus 2 holding cells for a total of 80. We have 64 officers, 3 shifts. On the 21st, we had 16 YOs. We had a count of 42. We had 15 in Pawnee County charged with murder. So when you add the murderers in, if we had done it that day, we'd get 57. We have 1 part-time licensed therapist who just, by the way, turned in his resignation. So we have none, but we do have that contract that we can try and find someone else. We're asking for 15 additional officers, which amounts to 3 posts. An additional post for each of the 3 units that we anticipate housing the violent longer-term offenders. For some of you that may not have been here or don't remember or didn't hear this, we're going from an average stay of a juvenile offender who stole grandma's car of 22 days to 160 days for drive-by shooters. That's about what it's averaging. who may go to, may be certified as adults, to 300 right now. It's actually higher, but when I last did it, for the kids who are under 18 charged with murder. Takes so much longer to go through that court process, and there's so much more things that have to happen for trial and so on. So it's a long, long-term haul. The pay, we're not asking for pay increases, but I did go ahead and ask them to kind of see where we were with regard to other juvenile facilities. I just put Oklahoma County Detention Center, which is an adult facility, up there, just so you could see that if I hire on over there, I don't need any experience. By the end of the first year, I'm at 42.3. But it's a heck of a job. I want more than 42.3 to do it myself, but I mean, that's where they are. But it really, in my opinion, doesn't apply to us, other than sometimes we steal from each other, and that can be problematic. But looking at the Comanche, Tulsa, and Craig County facilities, it looks like we're right in line. Actually, we're just a tiny bit higher right now, starting than the other facilities, and that's because you all have adjusted that, and I appreciate it. It's really got us where we need to be right now. So I wanted to share that, and I wanted to see if you all can, what else are you going to need to know to be able to decide what your recommendation is going to be? Because I got to get going. This is getting ready to happen. I got to get people hired, trained. We have ordered the fingerprint machine, so we're excited about that and getting that training going. And we actually we advertised the intake specialist, so that's going to be rolling. I want to be able to provide you whatever else additional that you can think of, or your boss might need. I have met with Mr. Warren. I've met with Commissioner Bloomer and Cody and Joe, and I'm willing to meet with anybody individually or whatever. But whether you vote for any more support or you don't, I got to get it to a vote. So I wanted to have one more opportunity just to talk to you today and to ask you what other things might you need us to check into before we try and get it back into BET and into budget board.
Jimmy, what's your request to cover the 15, or what's your request now without the intake, since that's covered, your badges and your fingerprint? What's your request aimed at today?
Let's see here. All right, I've got a licensed mental health, either position or money for contract that's still on the table for $60,741. And I have detention officers. It was for 10 months. It's probably going to be 9 now, but the 10-month figure was $692,768. So what is that? 692, 62, 10. What, about 762-ish?
What was the 762? I'm sorry.
I'm trying to add
The mental health
16.
person.
the mental health money for either contract services or, a person or 2 people. So this 6741.80. And if it's this much,
60.
it's not going to be 10 months for the detention officers. They're 46,180.
46 times 15.
Let's do 46 times 15 times 9 months. Because we're already past the 10 months. So 46,184
And then this one I thought was 690.
times 15 people
And then for 9 months.
times 9 months.
It's been right around there.
Well, that's gonna be.
And that's,
Jamie, the 692,762. How many months was that?
That was 10 months.
10
What we're
months?
trying to calculate now is what 9 months would be.
Yeah, that's what I.
This is the monthly cost.
Well, I'm just gonna do the 46,184.54 divided by 10 months
Okay,
times 9.
so.
that's why you're just.
On the
41,566
Yearly
Times 15.
budget.
times 15.
yeah, the 15 would be 831, 314, 40.
And then that way,
Six twenty-three.
623 what?
623, 340.
340.
She wants us to pay that.
That's for 9 months. 623, 340.
And these are rough, but I'm just sort of.
60.
For who?
So.
It gets a little nervy.
680.
I'm like, John, in the first place, you could have just given it to us.
Roughly 600, the request stands at roughly $684,081.80.
And that's for 15 DOs and 1 mental health.
Mm-hmm.
It's just a different approach, I guess.
So,
Yeah, and to me, they're separate, so what I'm looking at is the 15 DOs at 10 months is 692, 762. But I think when we're looking at that, we have to realize that next year, and this is a continued funding, so it'd be 831, 314, 40 annualized. So, and we'll have to, whatever we do, if we increase it, we're gonna have to remember that we're gonna need to annualize that next year and not forget about that.
Well, she'll get them hired, it'll be under estimated needs.
Yeah. But I'm saying when her estimated needs come in and it
And
looks
it's
like
a lot
it's
higher,
a lot
we'll have to
higher,
remember why.
we need to remember that that'll be part of it.
Sure.
Why is there such a big disparity in Tulsa County in the way that we do business, or like, as far as the number of employees? Or what are they able to do if you were to have the number of I guess, officers per capita?
I don't know, I
You don't
couldn't
know?
answer that.
I'm surprised to see they only have 3 units.
Yeah,
Would it have to do with the sales tax?
yeah. And, they have a whole lot of community support, financial community support.
So some of that.
I don't know
funding-
how
are you
much of
saying
that
some of
plays into
funding
this,
may be
but I'm
coming
just
from
saying.
private sources versus government sources?
Could be.
Donations. Interesting.
Have you looked at public-private partnerships?
That was kind of the.
I mean, we're talking about that for mental health as a possibility to supplement our mental health services.
I think those are things that we are really good to look at as far as capital investments for infrastructure and that kind of stuff. But as far as salary dollars, benefit dollars, that
They
kind of
don't
stuff.
wanna get involved in that.
Well, and I'm not comfortable going down that road anyway, because when those funds dry up, then we can't rely on that model, is what I'm getting at.
But you know, $10, that's great, that's good.
So if you have a special BET next week, then I'll probably put myself back on that agenda.
Yeah, I would recommend putting your numbers back in there,
Yeah.
an amount not to exceed, and put that in there, and we'll
I've
talk
sent,
about it to get something moved
Okay.
forward on the next budget.
I've sent this to all of you all, and to your elected officials, and communicated that I'm happy to meet individually. If you or your boss has any questions, or I think you might need to be prepared to answer this, or whatever, please let me know, because I've got to get something through, whatever that something looks like. And so I got to come next week, and I got to be as prepared as you need me to be.
Yeah, November 1's not far away, and I do appreciate you coming by.
Yes,
The
thanks, Nick.
discussion, he coming by, I guess it was yesterday.
Yeah.
Coming by and visiting, I appreciate that. I talked with Major Holmes a little bit, and he's helped me. Bruce been a big help on kind of filling in some holes that I've had, kind of like what Mike did on his item. So I appreciate you guys working to get the information and working with us so that we can really kind of wrap our head around what we're looking at. So
So are you telling me you're gonna put an item on for the Monday special meeting that's gonna say amount not to exceed? And when do I need that number?
yeah, will it be the same that you had on before on BET?
It'll be less.
Oh, because
I mean,
the
for
9
9
months, the 9 months instead of the 10 months.
Right, and the first item for BET, didn't that include the intake and the fingerprint? I don't remember, but it will be the number we need now, which is 9 months.
Can you, after the meeting, can you get
Yeah, I'll
with
get with
Kelly to
Kelly.
make sure that she has the exact, because we'll need that agenda item Well, no, as long as we
Post
schedule
it,
it,
yeah.
as long as we schedule it, then we've got time to, we'll have until tomorrow afternoon to get
I'll get with you.
it on there.
Okay. Thanks.
Thank you.
Thanks, Jamie. Is there a motion to receive the information?
So moved. Second.
Motion second. All in favor say aye. Aye. Any opposed? Ayes have it. Item 6, discussion possible action regarding recommendations to the budget board to approve a request for relief expenses from special projects by the 1400 CARES Act, in the amount of $3,011.73. This is a request for additional protection in the juvenile justice center intake offices to prevent the spread of COVID-19. I think this is plexiglass partitions.
I'll make a motion to approve.
Second.
We got a motion and a second to approve. All those in favor say aye. Aye. Any opposed? Ayes have it. Kelly, can you, for our next special, well, just for moving forward, can you go ahead and notate this $3,011 on the CARES worksheet that we have? That way when we're looking at the numbers available, we kind of have a good idea. And so 6 we'll get on next budget board next week. 5 we'll get on a special meeting next week for BET. Hopefully get that on the budget board as well. And then 3 and 4, we'll discuss those in special BET. Hopefully have items for budget board on those as well.
And 1.
Yeah, 1 will go on the budget board. All right, any citizens wish to participate? Seeing none, board comments? Mike? Miles? Danny? Christie?
Nothing.
Brandy? Mike? Brandon?
Amy, come back.
I want to thank Kelly and Danny for working on these documents and getting all the stuff in there for us. I appreciate it. No, you provided it to us in enough time that I could have caught it, and I scanned right over it. So. All right, is there a motion to adjourn? Is there a second?
Good, second.
All those in favor say aye.
Aye.
Aye. Christie, did you made the motion, right?
I think I second.
Brandon moved it. All right, everyone.
So why are we taking that as a reserve?
Okay, all right, just making sure. Yeah, I was looking for it and I didn't see it and I thought, am I not pulling my report time or what's going on? So, okay, excise. Okay, all right, thank you.
Yeah, might have been.
I think